Okay, now we're going to go on to the medical or the cancer history page. Okay, we've completed medical history. Now we're on cancer history. Okay, now we're going to ask you questions about you. A lot of these are redundant. We've already asked you some of these questions, but if you will, please be patient because we're going to ask a little bit more in-depth questions about your medical history. From this page, by the way, we're going to take notes and we're going to go back to the chief complaints section that we talked about earlier, okay? So we're going to use these to document in our chief complaints section back over here under products and services, that tab. We're going to go back to that, okay? But right now, let's ask the patient the questions. Have you ever experienced abnormal weight loss? A lot of times people will say yes or no, okay? You click yes, okay, or no. Have you experienced abnormal weight gain? A lot of people will say yes, I quit smoking, okay? The answer is yes. It doesn't matter why, okay? Any unexplained loss of appetite? Well, that seems crazy because the two questions earlier, abnormal weight loss. There you go. Maybe that's why. Okay. Remember, as I'm talking to the patient, okay, I'm asking you these questions. Again, we're trying to build a case for you so that Medicare will pay for your screening. So it's important that if you've had any of these, you let me know. Have you experienced abdominal pain? Click yes, okay? Now, where was that? Well, a lot of times it's lower right, lower left. Listen to the patient and click according to whatever they said, okay? Have you experienced nausea? Well, yeah, okay. I went on a roller coaster and I almost threw up. Okay, great. Did you throw up? Yes, okay. Have you experienced any weakness or fatigue? Well, yes, okay. Have you been, and you notice that question, when you click no, okay, look right here, the anemia. When I click yes under weakness and fatigue, it says, have you been diagnosed with chronic fatigue? And the answer is no. Okay, have you experienced any anemia, like a lot of bleeding? No. Have you had signs of jaundice? No. Did you have diabetes? If you click yes, it's going to ask you which type 1 or type 2. Type 2. Okay, that's more common as the people get older. Okay, have you experienced any constipation? It seems like we talked about that earlier. Yes. Any skin tags? A lot of people have skin tags. Skin tags are those little things that stick out of your skin. Some people don't know what that is, so you want to help explain it to them. Okay, again, none of these questions, I'm saying this to the patient, none of these questions are saying that you have cancer. None of these questions are saying you're going to get cancer. They're simply asking questions to see if we're building a case, again, for your intake form. Okay, so skin tags, no. Any blood in the stool? No. Do you have dry skin? Well, yeah. Sometimes when you get sunburn, you get dry skin. Okay. Rash. Seems like a similar question with dry skin, but do you have rash? Yes. Now we're going to go over here to the next side. Your blood in your stool. Okay, we already talked earlier. The answer to that question was no, but we ask it again. Okay, stomach pain, aches or cramps that don't go away. No, most of the time it's when I eat the wrong food. Okay, so any change in bowel habits? Yes or no. Irregular bowel movements. Well, I already told you that I've got whatever we talked earlier. We had questions about constipation, so on and so forth. Multiple colon polyps. Have you ever had multiple colon polyps? Rectal bleeding or blood in your stool. Abnormal bloating or cramps or discomfort. Okay, yes. Okay, feeling of bowel movement doesn't empty completely. Well, yeah, all the time. Okay. Stools that are thinner than normal. Okay, no. Okay, sometimes people say irritable bowel, and then you ask these questions. Well, yeah, I've got irritable bowel. They keep going over. Now, have you ever detected a new lump in your breast? Now, this is really important that you ask these questions because we want to, it's doing two things. Number one, it's gathering information, but also it could be educating your patient. It's important that you ask these questions. I know they're uncomfortable, especially if you're a man that's screening a woman. It's really uncomfortable. However, it's important that you stay professional and you ask these questions and you listen to their answers. Have you detected a new lump in the breast or underarm? Yes or no? Have you noticed any thickening or swelling of a part of your breast? Any irritation, or dimpling of breast skin? Any redness or flaky skin in the nipple area of the breast. Now remember, women aren't the only people that get breast cancer, men do too. So it's important that you ask these questions. What we're trying to do is uncover as much information of the patient that we can. Once you've asked those questions, then you go on to the next page.